All right. Well, here, Hannah. Cheers.
Cheers.
The way we start every Talk Mental Health with Logan Noon. This is the wonderful Hannah Udell, episode 9. If you guys haven't listened to episode 9, I think that was one of the best ones. Super good story about your wild journey towards medical school. ADHD, sexual assault, the depression, the whole 9 yards. It was great. You made me cry in that episode. It was a good one. In a good way.
Good.
But, so today is the 49th episode. Pretty cool, and thank you for coming back on. So we're talking about Do No Harm, which was a documentary screened at our school about physician and medical student burnout, produced by, I guess, Pamela Weibel?
I don't know if she produced it.
She was one of the people. Do you know more about, I guess, the basic facts?
Robin something was the director. I should
How
know
can
more.
listeners find this movie that we're talking about? At least the trailer.
DoNoHarm.org.com. I should know.
Or just punch it on
Google.
YouTube and
Yeah.
I'll put the links in the Instagram. It's fine.
Yeah.
Organization is not one of the reasons people like Talk Mental Health with Logan Noon. It's fine.
I should have looked this up.
No, it's fine. Don't worry about it. I'll put it in the... So,
it's Do No Harm Film. That's what it is. DoNoHarmFilm.com. A documentary exposing the epidemic of physician suicide and burnout.
Okay.
Yes.
So I guess let's just... I guess the way we'll kind of outline this episode is we'll talk about the movie, then our reactions to the movie, and then I guess just like what we feel about physician and medical student burnout and how we think that the problem could be improved upon.
Okay.
All right, so what did you think of this movie?
So I played a role in bringing it to Yakima, and so it wasn't something I looked up on my own. That you saw it ahead of time, right? Or you tried to get it right to the
So I, as the psychiatry club president last year, reached out to them.
Yeah.
And the screening fee was exorbitant.
Yeah.
It was something absurd. I was like, okay, our $70 in our student club account is not going to cover this. But either way, you got it together, so props to you, because you're part of what association again?
It's the Yakima County Medical Society.
Okay.
So I have a role, it's a student role on there, and someone who was in this position before me really tried to get it, and just it didn't go through kind of the vote and all of that stuff to get the money approved, and then so it was kind of, the project was passed down to me this year and got it approved. The cost actually went up to $5,000 to screen it. It's not available online, but these filmmakers put a lot of energy into making it, and so like any other film, that shows around the country, you have to pay a fee to show it.
And I think it eventually is going to be on the streaming platform.
Yeah, I'm sure it will be. I'm sure it will be.
So you listeners will get to watch for free.
Yeah.
Eventually.
Yeah. So planning for this started several months ago, and my main role was kind of getting the facilities, so getting PNWU on board, and because if you get...
You did a nice job. It was a good...
Thank you.
Good organization.
Good. Thank you. So it's a film about... It kind of follows the story of one guy who...
A medical student at first,
Yeah. I'm trying to remember how it even starts. Pretty much.
I think there was 3 separate kind of characters.
Yeah.
But there was that one main character who they followed him as a student, and why he was very significant in this story is because he attempted suicide and failed. So it was a good thing, but it kind of talked about why he did that, and then his role in residency and how he didn't like it in residency, and then also stories of other physicians who ended up being successful in their suicide attempts, unfortunately.
Yeah.
So what was your biggest takeaways? What was your biggest memories from that movie screening?
I mean, it's just heartbreaking to see this, but also it just left me wanting to know more about the actual numbers and the statistics behind this, and like the cover-ups that are going on. They talk a lot in broad terms about kind of cover-ups that happen oftentimes at residencies or like there's a big stream of, I think it happened in New York, maybe a bunch of people at one hospital committed suicide, and just very curious about from the administrative level why it's not dealt with, or how they deal with it, and how we could do better from that standpoint, I guess.
Yeah, I remember the scene I think you're talking about. It was, the kind of, I guess, master of ceremonies, whatever you want to call it, Dr. Pamela Wibble, was walking around that hospital where a physician did commit suicide, and she had pictures of the person. And so she asked just random employees of the hospital, like, hey, do you know what happened to this individual? And, like, nobody knew. They thought he maybe transferred jobs or was on vacation or something. And she was like, no, he, committed suicide. And, and it just seemed so strange to me, because it's like, okay, when, like, I've worked at organizations, when someone retires, like a huge blast email goes out, or like if there's some weird random policy change at the organization, big blast email goes out. It's like, well, why in these situations are there not like, hey, like this happened and you guys all should be aware?
Yeah. Well, I mean, I think in our general news, correct me if I'm wrong, but for the most part, you don't see suicides in the newspaper because I think the thought is, or it was in the past, that if you report on those things, and you see like an uptick in suicides. So I think just throughout our entire society, we don't talk about it, and we don't report on it.
Yeah, I mean, I liked the movie, and I also disliked the movie. I liked. I think people are moved by stories, not facts, all the time kind of thing. So, like, those compelling stories, hearing these physicians who... A lot of time, it also seemed like there was, like, some legal kind of concerns involved. Like, maybe they were going through a process where they were being sued. Maybe they were going through a process of losing their license or something. And it's like these people's identities was just so shook if they were no longer... a respected physician, maybe as they used to be, or whatever you want to say. And it's just like they couldn't live with that. And that's how I almost interpreted a lot of that movie. Sadly, though, I feel like I wasn't all that surprised. I guess maybe just because we're in the weeds. Like, we're in medical school. We're like, well, I knew that. So
that's what Dr. Beachy said.
Yeah. I would like to almost hear people's perspectives who don't know medical school stuff. Yeah.
I had a friend who was there who was not in medical school, who just was kind of dumbfounded by it, just had no clue that it was that big of an issue. I've heard people talk about in general how, I mean, it's multifactorial, obviously, but for the most part, it's understood that the rates of suicide are higher than the general public amongst physicians, and that physicians aren't reaching out for help, whether it be because they're high achievers and they don't deal with like kind of a breakdown of their health as well as maybe other people, or they don't feel like they can reach out for help because of confidentiality issues. Like you think about the electronic health record and how every person who has access to that, even though you're not supposed to, you have access to people who aren't even your patients.
Yeah.
So I'd love to see the actual numbers on why people aren't reaching out as much as they should.
Yeah.
And for example, just one of the resources in town, it's a program, like it's an employee health program for, I think, people at Memorial who work there, not just doctors, but other people. And you can see a psychologist or psychiatrist or someone in a confidential session. But I think it has to be, you only have like 2 sessions or 3 sessions per problem. So you can't really have a long relationship with them. Although I've heard that you can kind of say like, oh, I'm going to do 3 sessions for stress and 3 sessions for marital problems or something like that. So there is this like, oh, we have this thing to help you, but there's a very clear limit on it.
Yeah. And well, I feel like people outside of the world of medicine look at doctors and like they don't get why there is a burnout kind of problem. It's like, okay, physicians are well paid. They have a profession that like, I came from a world of insurance underwriting, which was god-awfully boring. And so I'd always think of like physician like, oh, I'm doing something meaningful. Like at least I'm like having an impact on people's lives versus like saving some billionaire an extra few cents on the dollar kind of thing. And so, outside of the world of medicine, I feel like people just don't get it. It's like, well, why are these physicians committing suicide, excuse me. Or maybe they just simply don't know. I feel like it's kind of coming more and more into the mainstream, but I'm not really sure.
Yeah, I don't know how much of it it's becoming more mainstream versus like I'm more in the world, and so it doesn't seem shocking to me anymore.
Yeah.
That was the same thing with you. I watched that and I was like, none of this is shocking to me. So it's hard.
I struggle talking about burnout. I remember actually prior to that event, someone asked me, because I like public speaking, they're like, are you talking at that event? And I was like, well, I hope not. Because I feel like the worst of my depression was prior to medical school. And I feel like because I went through that very challenging time of my life, I developed all these coping mechanisms that I've been able to apply to medical school. So I almost feel like I'm in a better position to handle this. Like, do you feel that way?
Oh, definitely. Yeah, definitely. I feel very fortunate that I went through like struggles in college and other times of my adult life. So I have tools that I'm now using in medical school. But I admit, like, I'm just so afraid of residency. Just like, I think a lot of people are afraid of this whole burnout thing and just what we hear lies ahead for us. And it's almost like paralyzing because it's like, well, we have to go through that. Everyone has to go through residency. And it's supposed to be hard, and I guess in the film they talked a little bit about putting the cap on the number of hours and how that was then overturned.
Yeah, I was about to bring that up.
Yeah, and I don't...
So why don't you explain that to the listeners who have no idea what they're talking about?
Okay, so for residency, which is what you have to do after medical school, it's from 3 to 7 years. Notoriously, everyone has worked really, really, really hard, and I think that there was a cap... I don't even know what legislating body did it.
That's a good question. I thought, I don't know either. I thought it was just, I don't know, the American Medical Association. It wasn't Congress.
A cap of like 80 hours a week.
Yeah, which it seemed like people were still working more than 80 hours a week.
Yeah, so it was stupid.
And then they did this whole study about how, because it all came down to like patient safety, I remember. And okay, we'll put this cap on resident hours per week, and they did this big study on if it's going to have a positive impact on patient safety, and it didn't really. So they kind of just said like, fuck it, and whatever. And I think it really varies depending on the specialty, of course. I think psychiatry is a little less hour intense than maybe surgery or like OBGYN kind of thing. Yeah. But I just know like the running joke, it seems like, is resident doctors are per hour like the lowest paid employees at a hospital.
They're super cheap labor.
Yeah.
Because they get paid like, I don't know, average of like $40,000.
Yeah, I think it might even be a little more healthy than that. Okay. But like 50 or something. Yeah. But either way, when you're working 80 to 100 hours a week, that's not... Yeah. And you are doing essential doctor work.
You are, yeah. And they're the ones who are on call. And not in every residency program. I know a psychiatry program in northern Wisconsin. I've got connections there, and the residents don't take call, which is kind of on the other end of the spectrum as well. Like, are they being adequately prepared for patient care if they don't have a more intense schedule. And I think that's kind of where my fear comes from, is like feeling like I can do well and I can like perform under pressure, but only if I get 8 hours of sleep, you know, and only if I exercise every day, and only if, you know, and then recognizing that there will be this time when I'm working 80, 100 hours a week, and I've never done that before, and I don't think my body can take it. Yeah. And it's like, if I'm, you know, feeling really tired, for example, this week, like you and I were talking, like we're not even studying, but this patient care is exhausting, and we're not even the ones who are responsible for these people. We're just there learning. So I'm just terrified, I guess, of what's to come. Yet, I guess I'm not motivated to, I don't know, do anything, because we all have to do it. Yeah. And if I feel
then we have no positions of power at the moment.
Exactly, yeah. And part of me, like, I will be looking, when I look at residencies, of how much call they have and what seems like a healthy amount, but there's a little thing in the back of my mind that's saying, well, you know, are you just looking for the easy way out, you know? And if you do go to a residency where you don't, you know, take call, for example, does that mean that you're going to be not as good as a doctor at the end? I don't know.
Yeah, I feel in this weird place because sleep is so vital for my bipolar management control. And prior to medical school, I did a few overnight shifts, and it fucks me up. Oh, yeah. Yeah.
I did one all-nighter in medical school, and I had an auditory hallucination.
Oh, really?
Yes.
Wow, yeah.
I never had that before.
Yeah, it's like, and I think it's just because I maybe have ego issues, but like I really pride myself, at least now, as I don't want accommodations because I have bipolar disorder. It's like, no, like I want to be thought of as a normal student kind of thing. But I'm very, very concerned once I enter residency. It's like, if you keep me up for 4 nights in a row or something crazy, like I'll have a manic episode. I'll put $1,000 on it. And it's like, I don't know. So I'm very, very concerned. And another big, I remember, takeaway from the movie that I didn't really realize is, you know, I'm very open, you're very open about like taking meds, going to a therapist, using the mental health system. And it seems like physicians who are open about that or go through the proper channels sometimes get almost like blacklisted or like red flagged. Like they have to go through all these extra hoops, random drug screens, like all these like kind of random programs. And one thing I learned from that documentary, and then there was like a Q&A after, is how many people use like pseudonyms or like pay in cash out of pocket to seek out mental health care so that they don't get red flagged. And that was very, very alarming to me. Macy's husband, Kendall, goes to me, he's like, dude, what are you gonna do? He's like, you know, someone could Google your name and in 2 seconds find out your bipolar disorder. And it's, I just try not to think about it, but I know it's kind of a reality of the system.
Well, I mean, your approach, correct me if I'm wrong, is like the more I talk about it, the more I normalize it, the more other people feel empowered to talk about it. And I agree that that's a great approach. I mean, I think it's important to have healthy boundaries with your patients. And in the future, if patients, you know, like, you know, approach you or me or whatever about our own issues, like I think we will have to like make some choices to, you know, share or not share. They can read what they want, but in our visit with them, keep those boundaries. But where was I going with this?
I don't know.
Oh, yeah. I don't know. I should have done more research. I don't know what those rules are in terms of docs who have any sort of mental illness, when they have to report that. And I just feel like using pseudonyms and going out of network to get care, that's just increasing the stigma. And if we can't, as providers, feel comfortable getting help, how can we ask that of our patients?
Exactly. Yeah. And it even seemed like people were afraid to take medication because then you really can't use a pseudonym. It's like you can't go to a pharmacy and use a pseudonym.
Yeah.
And so it seems like we identify these treatment modalities that we eventually will prescribe to our patients, yet we're afraid to take them. It just seems ludicrous.
It is weird, though. I don't know if you've noticed. Like, I get this. Like, I went to go fill a prescription of mine, and there was a pharmacy student there, and like he and I have had a conversation before because goes to the pharmacy school that's associated with PNWU, and it's like you look at that prescription and you could but at the same time that's like his job, and as a as a healthcare provider, and I'm guessing HIPAA laws would like prevent him from sharing that with anyone.
Yeah.
And it's the same thing. Like when we're in clinic, I'm sure like, even as students, like we're rotating with doctors who then our classmates come in to see. So we just kind of have to trust the system. Yeah.
Yeah. I mean, there was like, so I guess we've talked for 20 minutes, something like that. So some things I didn't like.
Yes.
Like it seemed, so there's hotlines that are endorsed by these large organizations. I think, what was it? Washington's Physician Health Program, and I think most states have physicians' health programs. And, I don't feel comfortable with promoting that we shouldn't use those. And there's these other avenues that, like that one website that was referred to in the movie. It's like, okay, like that might be a good option, but, if 10,000 physicians a day or something like that are going to call into this hotline and it's only run by maybe one or two people, that's not sustainable. That's not a good way to tackle this problem. And I get that there's problems with the physician health programs, but it's just like, that's not a solution to this problem here. Like, that seems so stupid to me. And that really, really rubbed me the wrong way. It's like, we should try to improve the systems that we have rather than trying to tell, I don't know.
Yeah.
It was weird. What did you think?
Yeah. To give listeners some context, there were some people who came and shared stories after the film about their loved ones who were doctors who committed suicide in Washington. And they had amazing, it just was like so amazing to have them there. They were very well spoken, I thought, and just told a very it just was heartbreaking, but also I felt like well told stories. And several of them were their loved one was going through some sort of disciplinary process at the time, whether it be right or wrong. That kind of seemed to be the thing that they pointed to as causing their death, was this physician's health program, which my understanding is the way that in which doctors who have any sort of behavioral issue, substance use issue, they can keep their license if they go through this program. And I just felt like we should have moved on from that conversation of pointing a finger at that and talked more about, okay, what programs do we have in place and what do we like about them, and actual things that we could, there was a lot of talent in the room, there are a lot of ideas in the room, and I wish we would have kind of used that more. Yeah.
I kind of equate sometimes, I was thinking about this before you came over, talking about burnout to talking about mental health stigma as a whole. And there's a lot of mental health advocates like myself who maybe have YouTube channels or Instagram pages, podcasts, whatever they mean. And not all of them, but some of them are like, we need to stomp out the stigma. We need to end the stigma, rah, rah, rah. And I don't like that approach to the problem. Just almost like, for lack of better expression, like crying about it. It's like, we need to offer solutions and ways to improve the problem. Like, I don't like just complaining. Like, I feel like we have to offer actual solutions. And I mean, I get complaining. We do need to raise awareness about this, but it's like, we need to approach the medical system with an alternative option. And until we do that, it's like complaining doesn't get us anywhere.
Yeah. I think the approach of some people involved in that film was like the shock value of this is happening. And maybe that is needed for the general public. Like you and I said, we're in this world now, and so it's hard for us to understand, is this even surprising? But maybe for some people, yeah, it is. And that shock value of just like, this sucks, and this is a thing, this is happening, like that's beneficial. But yeah, I mean, I'm the same way as you. It's like, I want to talk about like what we can do and also talk about burnout, not just in like what it looks like, or not just in like the word, but like actually what it looks like on a day-to-day, what that means in terms of when a doctor wakes up and how they feel and how it affects the conversations they have at breakfast and how they interact with their family and how they interact with their their nurses and MAs and the relationship with electronic records and actually just like, let's talk about feelings and let's talk about more specifics rather than just this kind of broad thing.
So I work at a clinic now that I think it's a family medicine clinic that I think really represents what I feel is almost as good as it gets at the moment of medicine for, I guess I can't necessarily say for patients, but for physicians. None of the physicians work full time.
Cool.
They work like normally 3 days a week or 4 days a week, and I get a sense that they're not there for the money. And I really like that, and I emulate that in my future career. I don't know how much I'm really going to be able to do that at first. I'll be graduating with well over $300,000 worth of debt.
Yep, same.
It's super scary.
Terrifying.
And so that's one thing that motivates me. That I guess more scares me about burnout, and because I feel that I'm going to be so scared by that debt and so almost weighed down by that debt that I think I will work much, much more than I want to.
Yeah, I totally agree. I'm like, right off the bat, I've always said that I don't want to work full time, not because I want to like necessarily like raise a family or anything, but because I want to cook and hike and enjoy my life and not let work consume me.
Well, one thing I got from the movie, and we already kind of talked about it, it's like when these physicians, like, maybe were threatening to get their license taken away or whatever, it's like that was their only means of an identity. And I think that's really, like, the big problem.
Yeah.
Like, if I'm no longer a doctor, like, my life's over, and it's like, I never, ever want to feel that way.
Yeah, I totally agree.
And, like, I feel like I kind of sound like a broken record, but like it has to be balanced. Like I want to be a husband, a father, aspiring golfer. I want to be a race car driver. I have like all these crazy things. Hiker, like you said, but it's like, if medicine is taken away from me, like, listen, like I worked in insurance before. I'm not going to love it, but I'll go back. Like I don't ever want to think like, I don't know, my life is just medicine.
Yeah, I mean, we go through all this training, though, and I wonder if there's, already a shortage of doctors. If every doctor said, enough, I'm going to only work the amount that's healthy for myself, what would that look like? Yet at the same time, if we had well-rested doctors and we had an electronic health records system that worked for us and wasn't just like this advanced billing platform for the insurance companies, and we really had like a streamlined medicine that was efficient, maybe that would be more realistic. I don't know.
That was one thing I thought that was missing from the movie, is almost like, okay, it's medicine kind of thing. Or like, is this more difficult in... That's fine. So what are your I guess like final thoughts kind of on burnout? And like, I kind of look at it, we're not in positions of power yet, but we will be. So like, what is, I guess, your kind of course of action of how are you going to help other people around us?
I think it's important to have physicians in positions of power, to have physician-run organizations. My understanding is that it's oftentimes leads to more satisfaction in employees when the health system is run by people who actually understand what the needs are of the docs. That makes sense to me. I don't know. I think it's important for people to not shy away from what their struggles are, and not just say, oh, I need to kind of take this time and take off, but maybe be a little bit more like, okay, it was these specific things that I think led to my burnout or led to me, I don't know. And instead of just taking off for a little bit and coming back and then getting fed up again and just taking a vacation again, actually being vocal about what those issues are. But this is obviously coming from someone who has no clue what it's like to be in that position. Yeah. And I'm mostly just scared about it. But I hope that, we can keep talking and our classmates can keep talking, and we're all going to be going through it together. We're going to be in an intern year across the country. And curious to see, as this new age of doctors comes in and we're people who are a lot more vocal about our mental health needs, maybe that, a change will happen. Yeah.
I kind of look at it, it's like doctors, I feel like, used to have this old, almost the ivory tower, I'm so much smarter than you, I'm so much better than you, I'm so much richer than you kind of thing. And it's the more we can identify, oh no, I have problems too. This is how I treat my problems. And maybe this is how you can treat yours kind of thing. People in clinic all the time talk about oh, I lost weight and this is how I approached it. Why aren't we having the same conversation about I felt really, really sad and being okay with that kind of thing? I also really think I think I would love to see studies on our system versus Europe's socialized medicine system, because I think that has to produce happier doctors.
Yeah, I wonder, because like I said, with our electronic records being this billing platform, it's all for insurance, and I wonder if we didn't have such a crazy insurance system, if that would be a lot simpler, and then you wouldn't have so many middlemen. I mean, there's so many people who are in between having an appointment and then what happens with the billing and the coding and all of that stuff. And that just jacks up the price of everything. And I wonder if there was a more simple system, things would be less costly. And I forgot about this until now. So many doctors have said to me how frustrated they are by insurance companies randomly not covering the certain inhaler. And a kid going without their inhaler, and just not even saying, oh, we're going to cover this other one, just saying we're not covering that one anymore. And then just flip-flopping back and forth. Every 1 year it's this, and then it's that times however many patients are on that inhaler. And the doc's okay, sure, fine, switch, fill this other one. But that just happens time and time again. And it's, and that's just one example. Just this week, I heard so many conversations of someone saying to the doctor hey, they won't cover that specific antibiotic. And it's just time and time again that happens, and that really the doctors have said to me this is the reality of my life. This is the shit that really sucks. And so I just feel once we when we do get a better system, because we will elect someone who will change our system and make it better, right? Yeah. That some people like, oh, are you worried as a doctor that like your salary won't be as good if we have more like socialized medicine? I'm like, hell no. Like, no, I'm not.
If you went into medicine for the money, you're a fucking idiot.
Yeah, right. There are other ways to make money.
And I mean, just honestly, this week, and this is more from a patient perspective, but like I have been seeing essentially the same therapist all of medical school, and I'm now third year. And my wife switched jobs. I get insurance through her. So I've seen the therapist, I think like two times since switching to new insurance. And I get this call, hey, we're not covering that. That provider's in our network, but we're not going to pay for those services because you didn't have a prior insurance authorization. And I was like, I've seen that person for 3 years. They give me my bipolar meds. They provide therapy. She's a nurse who does both, nurse practitioner. And I was just like, what the fuck? And the billing person from her office said I should call the insurance company and explain the situation and beg, but she highly anticipated that it's not going to work and I'll probably have to pay like $400. And I was just like, I don't know.
And that's a pain for you, like in this privileged position, like being able to articulate what your needs are and everything, like, and they still think that it's going to be denied.
Yeah,
like, that's just ridiculous.
Yeah. And it's I don't know. I mean,
it shouldn't be that complicated.
Yeah. And I also like kind of, I lived in Scotland for a while, and I had some friends who were in medical school there, and they were in medical school at 19 years old. And like, it was right out of high school, and I think it was like 6 or 7 years of training, and then they did their residency kind of thing. Mm-hmm. And it was just much more spread out versus the American model, which I feel like I would have retained so much more of that information if it was at a slower pace and less intense. Because it just kind of, it turned into me cramming information. It turned into, it wasn't an enjoyable learning environment. I've always enjoyed school from a very young age. And I enjoyed parts of medical school, but some of it I definitely hated.
Mm-hmm. Yeah. That's a good point. I am grateful for doing undergrad and learning stuff that if I would have just started this medical school track and not been able to take, anthropology courses or something really interesting, I would have been sad. But yeah, that's a good point. Just, it'd be wonderful to talk to med students in Scotland.
Yeah. Well, and then there's this one doctor that I really enjoy speaking with, and she's on Instagram at Freud in Fashion. Freud in Fashion. I've had her on the podcast. She's awesome. Interesting. And she wrote me a letter of rec. She's a great woman.
Oh, cool.
And she kind of says her method for approaching burnout is like, for physicians, you should look at it as having multiple different income streams kind of thing. Like, she makes some of her money off of obviously seeing patients, but she also does like speaking engagements kind of thing and other consults. Yeah, Magdalena is being a terrible assistant producer for this podcast right now. So hopefully these listeners weren't too distracted by the dogs. I think we should go hang out with the dogs and drink some more beer.
Definitely.
Listeners, hopefully you still enjoyed talking to us, or listening, whatever. I can barely even focus right now listening to these crazy dogs. But, cheers. Let's finish it off.
Yes. To hopefully not having such horrible burnout in the future.
Well, and one way to approach burnout is maybe getting a dog. I actually posted on Instagram about that today.
I saw that. I loved it. Oh my God, I'm so glad I have Opie. He saved me. Seriously.
Yes. All right.